I wanted to just take a moment and switch gears a little bit. What are your thoughts on how this technology and other technologies that go along with it in spine surgery, as you move into the ASCs, as you move into technologies that help with the length of stay and better patient care and better quality and better outcomes? Can you give us some thoughts and sort of your perspective on that, and where do you see this go?
Outside of the instrumentation space is something near and dear to my heart. I've spent the majority of my last 15 years really in the space of measuring outcomes, defining not only the quality of how we do it based on the variability we deliver care to come up and really understand best practice, but variability in outcomes and understanding best patient, best diagnosis, best treatment, and then also proving and demonstrating the value of what we do in spine surgery. One of the biggest challenges has been the unbelievable resources and costs it takes to use traditional measures, patient-reported outcomes, patient interviews. It's important to do it in a valid, scalable way, and it's necessary through value-based care for all of us to get better. If I were to think about a technology that would be required to transmit data in real time out of the body, it would have to become smaller. It would have to incorporate certain pieces and parts that wouldn't increase the overall volume. More is the perfect carrier for that. And it's so exciting that the expertise in this company is in smart implants. So, this is just a slide here showing the software applications that are launching later this year that are going to be patient-facing, hospital-facing, and physician-facing. It's going to incorporate Fitbits to understand mobility, in addition to apps to give feedback on pain scores, progress, gamification. But these are things that can link into EMRs, can give not only patients and their caregivers, but doctors real-time data on how they are recovering. And you can imagine just wireless transmission, battery-free, just like the founders of this company created pulmonary artery implants. True data that can transmit to the clinician and patient on how the inner body's doing, how much strain on the rod, reduction in strain across inner bodies as arthrodesis occurs, getting a telemedicine remote consult, having the patient do a simple flexion extension on the screen, and transmitting the data to your computer to understand load and picking up pseudoarthrosis, and just quite frankly, being able to capture outcomes in an incredibly scalable way across healthcare systems and in our practices. So this is something that I'm most excited about in this company, and I truly believe as it mirrors to the hardware implants, it will be a game changer, I believe, to how we look at all orthopedic implants moving forward.
Now I want to ask a couple of questions. One of them comes from William, who asks, how hard is it to bend the Moore rod?
It is fascinating for a stronger, more durable rod to be a little bit more malleable. And I find it much easier to bend than cobalt chrome, somewhat similar to titanium.
One last question, and I think this person researched our website and said, I looked at sagittal alignment system that has been described on your website. Could you talk about the application of sagittal alignment system in lumbar and posterior cervical? So I can pose that to Dr. McGirt. You want to take one of those?
Yeah. One of the challenges, obviously, with the increased understanding of how important it is to not just use someone forward, sagittally, or flat back, and to obtain appropriate lordosis, whether you're doing a 3-level T-lift or whether you're doing a deformity case, it's become obvious. And one challenge has always been getting real-time data on exactly the alignment that you've just locked someone else, locked the patient into. And so this system is fantastic because it gives you real-time intraoperative data of exactly the segmentation throughout the spine, and it gives you that feedback in probably the most accurate way we have today. And so that really matters.
Dr. McGirt and Dr. Poelstra, we appreciate your time and energy behind the topics that you covered and the excitement about the Moore alloy. And I want to thank all the listeners who tuned in late in the evening to listen to Dr. Poelstra and Dr. McGirt. And please feel free to contact us with any questions, and I look forward to engaging in more conversations. So thank you very much. Have a good evening and good long weekend to all of you.